So there have been multiple studies that have looked at how antidepressants can cause sexual side effects. And what I'm going to do is compare the 5 most common antidepressant classes so that you can have a better understanding of the level of risk that you're taking when starting a medication. And make sure to stick around to the end because I'm going to fill you in on my favorite antidepressant to prescribe that has the least amount of side effects. The first medication class that we need to talk about are the SSRIs, or the selective serotonin reuptake inhibitors. If you're being put on an antidepressant for the first time, odds are it's going to be a medication from this class. And that's because these are often used first line in treating depression, anxiety, OCD, PTSD, and the list goes on and on. The medications found in this drug class include fluoxetine, sertraline, escitalopram, citalopram, paroxetine, and fluvoxamine. The rate of sexual dysfunction seen with the SSRIs is thought to be somewhere between 30 to 60%, right? But what you need to know is that the range is quite variable, and some studies have shown rates as low as 10%, while others as high as 80%. And regardless of the exact number, the big takeaway is that there's an overwhelming amount of evidence suggesting that high rates of sexual dysfunction are seen across all the SSRIs, okay? Now, when comparing one SSRI to another, studies have not found a huge statistical difference between each of the medications, but there's some evidence suggesting that fluvoxamine might cause the least amount of sexual side effects, while paroxetine might cause the most. The second medication class to look at are the SNRIs, or the serotonin and norepinephrine reuptake inhibitors. The 2 most commonly prescribed medication in this class are duloxetine and venlafaxine, and the rates of sexual dysfunction for SNRIs are thought to be generally comparable to those of the SSRIs. When comparing these 2 medications head to head, it's believed that venlafaxine carries a higher risk of sexual dysfunction than duloxetine. Now, if you're looking for an easy way to keep track of all this information, make sure to download my PDF in the link below because I already have all this information nicely organized for you. The third medication class to know about are the TCAs, or the tricyclic antidepressants. And these medications work sort of like the SNRIs in that they affect both serotonin and norepinephrine. And what you need to know is that some medications in this class affect serotonin levels more strongly than norepinephrine levels. And remember, increased serotonin reduces both sexual desire and sexual functioning. So for example, clomipramine is one of the most serotonergic TCAs and is the worst when it comes to causing sexual dysfunction. On the other hand, desipramine and nortriptyline affect norepinephrine more strongly than serotonin. So they've been shown to cause the least amount of sexual side effects. But when looking at the class as a whole, it's thought that the TCAs carry around a 30% risk of causing sexual dysfunction. The next class of antidepressants are the MAOIs, or the monoamine oxidase inhibitors. These medications, like the TCAs, are used less frequently, and the rates of sexual dysfunction that I've seen range somewhere between 20 to 40%. The exception to this is the transdermal selegiline patch, which has been shown to have rates of sexual dysfunction that are comparable to placebo. Okay, at this point you're probably thinking, so are there any medications out there that don't cause sexual side effects? And the answer is yes. This takes us to our 5th medication class, the atypical antidepressants. And there are 5 medications in this class that are commonly prescribed that I want you to know about. The first is mirtazapine. The majority of research for this medication has demonstrated that the prevalence of sexual dysfunction is lower than the vast majority of the medications that we just talked about. Rates are generally thought to be around 24%, okay? The next medication is trazodone. Not only is it thought to have lower rates of sexual dysfunction, but also earlier reports have documented the potential for it to cause increased sexual desire and prolonged time to orgasm. But don't forget, this medication does have the risk of priapism in men, which is a prolonged painful erection. So you definitely want to monitor for the side effect if you start this medication. 2 other medications to be aware of are vilazodone and vortioxetine. Both of these medications so far have been shown to have rates of sexual dysfunction similar to placebo in randomized controlled trials. And the 5th atypical antidepressant that is one of my personal favorites is bupropion. There's strong evidence showing that this medication has less sexual dysfunction than all the SSRIs, SNRIs, TCAs, and MAOIs. Not only do sexual side effects occur at or below the rate of placebo, but there's some evidence suggesting that it actually has a positive effect on sexual functioning by increasing sexual desire. So now that you know which antidepressants are the best and worst for causing sexual side effects, the next thing I need you to know about are 3 easy strategies that you can try at home to reduce these side effects. Click on that top video to find out more.